Today, we're going into the world of medical imaging to unravel the mysteries behind two very common ones, X-rays and CT scans. We'll talk about how they work, how they are different, when one might be preferred over the other, the amount of radiation they use, and the differences in cost. If you're a student, a patient, or just plain curious, you are in the right spot. This is MedScience Simplified. I'm Dr. Zikky. I am a Board Certified Radiologist. First, let's talk basics. X-rays are like cameras that can see through your skin to reveal the hidden structures in your body. It's particularly useful in your chest, belly, and most importantly, the bones. On the other hand, CT scan, which stands for computed tomography, takes this a step further by using multiple X-rays from various angles to create a three-dimensional image of your internal organs. Yes, CT scans use multiple X-rays to produce a much clearer and much detailed 3D view of your body and internal organs. Why would a doctor choose an X-ray over a CT scan or vice versa? Well, it depends on what we're looking to find out. X-rays are great for a quick check on things like broken bones, lung infections, or intestinal obstructions. They are a quick first step examination, but sometimes the doctors may need to take a closer look, especially if the bone break is not too straightforward or what we see on the chest and belly are not very clear on the X-rays. We'll likely choose a CT scan as the next step because it gives us a lot more detail of those problems that are not too straightforward. When we look at your chest and belly, an X-ray is like the initial screening tool. Often it may suggest that something is abnormal. A CT scan then follows to clarify exactly what we were suspecting on the X-ray. Imagine your internal organs are hidden in a room, which is your body, right? Using an X-ray is like looking into this room through a frosted window. You may catch a glimpse of what's abnormal inside. A CT scan, on the other hand, is similar to walking directly into this room, allowing you to see every organ much clearer. The process for getting an X-ray or a CT scan is efficient and usually straightforward. Typically, X-ray imaging involves standing or sitting down, but if these positions are not possible, accommodations can sometimes be made for the patient to lie down. In contrast, a CT scan requires the patient to lie down on a table that smoothly glides into a donut-shaped scanner. Both methods are non-invasive and usually free from discomfort. Another key difference is the time and preparation involved. An X-ray is usually quick with no special preparation, usually. A CT scan, however, can take longer and might require contrast material, which is either injected or ingested, or a combination of both. The contrast material allows us to highlight specific areas inside of your body that we are interested in seeing. Now let's talk about the big one. Radiation. Yes, both X-rays and CT scans use radiation to create diagnostic images, but CT scan uses more radiation than X-ray. To put this into perspective, radiation from X-ray is about the same amount of radiation you get naturally from the environment. It's pretty small. On the other hand, one CT scan can have the same amount of radiation as 100 to several hundred X-rays. Of course, this varies with the type of CT scan and the area of the body being scanned. As you can see, the amount of radiation on CT is more than that in X-ray. However, they are still considerably small and considered safe. Additionally, we always weigh the benefits and risks carefully before recommending a CT scan. Usually, the risk of not finding out what's wrong with your internal organs and appropriately treating it outweighs the small risk of radiation exposure from CT scan. Considering cost and availability, X-rays are often less expensive than CT scans, and you can usually get them at your local clinics or urgent cares. They can range anywhere from $100 to $1,000 or even more. CT scans offering greater detail tend to be pricier. It might require a trip to a hospital or a specialized imaging center. They can range anywhere from $300 to $6,000 or even more. Now keep in mind, these costs do not take into account insurance coverage. As you can see with this wide range, the prices can change a lot depending on where you are, who you are, what kind of X-ray or CT scan you need, and your insurance coverage. It's all part of the complex healthcare system we have in America. And if you're watching from another country, things might be different, but I'm not too familiar with the healthcare system outside of the United States. In medicine, it's all about using the right tool for the job. For simple, straightforward bone-related issues, X-rays are usually sufficient. But for complex diagnoses, especially involving the chest, abdomen, and soft tissues, CT scans are usually needed initially or to clarify suspicions that were seen on the X-ray. Before we wrap up, a quick note on safety, especially for pregnant women and those with special health conditions. Always inform your healthcare provider about your situation, as there are special considerations that we may have to keep in mind. In summary, while X-rays and CT scans both play important roles in medical imaging, they serve different purposes based on the level of detail required and the special area of the body being examined. Remember, whether it's an X-ray or a CT scan, the goal remains the same: to provide the best care for you. Thanks for watching. If you found this informative, please don't forget to like, share, and subscribe for more health tips and insights. Please drop a comment with additional questions if you have one. Let's talk. I'll see you in the next video.